So, vector-borne diseases, those diseases, the infectious diseases that are associated with insects and other vectors, are a significant cause of morbidity and mortality around the world. You can simply go in your backyard on Long Island and contract tick-borne diseases. So it's one of the things you don't have to travel. We have them right here on Long Island. So in 1982, our scientists at Stony Brook University, in collaboration with scientists at the National Institute of Health, made the absolutely groundbreaking discovery that the causative agent of Lyme disease was a spirochete, this kind of curvy bacteria associated with ticks, and they isolated this bacteria from ticks that were actually found on Shelter Island. So there really is a very strong connection with this. From that point on, our scientists also were able to isolate the spirochetes from people who had Lyme disease, again, patients in Suffolk County with Lyme disease, and isolate that and provide that first isolation, and then help develop the diagnostic tests as well as therapeutic regimens. Once you knew it was a spirochete, once you knew it was Borrelia, you knew the kind of antibiotics that were most likely to be effective against this kind of organism. So that changed the whole approach to Lyme disease, basically, and really helped give it a cause and helped give it a therapeutic approach as well as a diagnosis.
And New York State bears a totally disproportionate burden of tick-borne disease in the United States. And we here bear a disproportionate burden of tick-borne diseases in the state. Since the early days of the Rocky Mountain spotted fever, we now have 5 tick-borne diseases that can be acquired in Suffolk County. Maybe there is even a 6th one or a 7th one that we don't have a very clear idea about yet. Cases of Lyme disease in Suffolk County, this is for the last 5 years. They hover between 500 and 700. Don't forget that these are reported cases. This is probably the tip of the iceberg. Lyme disease, as we mentioned, is mostly a disease of children, as you can see from this age distribution. And peculiarly, it's also mostly a disease of boys.
But from 2016 to 2018, we have had more than 500 referrals of Lyme disease and other tick-borne disease, not just for New York, but also from other states and even from other countries.
And I just want to sort of shed some light on what is actually happening in the lab. What do those tests constitute? At this stage, there's certainly no single test that provides optimum clinical sensitivity and specificity. It requires several tests and a lot of good clinical judgment.
Lyme disease is preventable. I think we need to really understand the ticks, but I think we need to really empower patients to know what they can do to prevent tick infections, be that after you're gardening or after you're running outside, you throw your clothes in the dryer, hot dryer for an hour, you do regular tick checks. Recognizing what could be an erythema migrans rash and knowing to bring that child to medical attention. So I think there's a lot we can continue to do within the community.